It is not my job to manage other people's emotions. If I say something that's triggering for another person, then that's a reflection of their boundaries. It's a reflection of their insecurities. It's a reflection of their priorities. It's a reflection of their triggers and whatever's going on for them. And it's not a reflection of me. My coaching is more forward focused and forward thinking and visionary. This is where I want to be in 6 months, 1 year, 3 years, 5 years, 10 years. This is the legacy I want to leave. This is the impact I want to make on the world around me. And how do I get there? And what might be some of the thoughts that are holding me back? What might be some of the barriers that I'm consciously or subconsciously putting in place? What might be expectations that society has of me that I either recognize or don't recognize? And how is that impacting my life? So all of those things are explored in coaching.
Hello, everyone. Welcome back to the channel. Disclosure, I have a good friend right in front of me. We have Dr. Laura Suttin. Dr. Sutton and I had the opportunity to meet at the ACE conference, and I know she is a delight, and I cannot wait for her to share her story with you. And she's going to also share how she got interested in coaching, the impact coaching has had on her life, and now what she does to live it to give it. So, Dr. Laura Suttin, welcome to the channel.
Thank you. It's so good to see you. I've been looking forward to this for a while. So very excited.
Me too. And for the audience, can you share a little bit about your story?
Yeah, I am a certified coach. I achieved my coaching certification last year. I'm a family physician, still see patients, still practice. I decided to become a coach probably about 3 years ago. I had some colleagues that were coaching at the time, and I also had the opportunity to be coached myself. I've been working with the same coach actually now for about 10 years. And I also hired a coach to help me more on the business side. So a little bit of different perspectives, kind of personal coaching and then also business coaching. So I have two coaches that I work with. That's how much it takes to to help me ground myself as two coaches. So I just was so impacted by coaching myself. I learned so much from my coach, and I learned how to reframe my mindset, how to see a different perspective on things. It really helped me with my relationships. I was going through a divorce at the time. It helped me through that. It helped me to reestablish myself, and it helped me in my leadership. I was starting out as a physician leader at the time. It was so incredibly impactful for me, and I wouldn't be where I am without it. So I wanted to give that back to other physicians. So I achieved my coaching certification last year through the Physician Coaching Institute, and I'm really excited to be doing some coaching and to really kind of give back to other physicians as I've had the luxury of working with other coaches. So
Yeah, and to kind of give an example or of some of the things that you were looking for, so for someone who may not have had coaching, do you kind of remember at the time what information helped you to even know to seek out a coach?
yeah, I was offered a coach. I wasn't seeking one out, but as I said, I was really growing in my physician leadership at the time, and my organization was investing in me and several other physician leaders as emerging leaders and future medical directors. And so they offered us coaching through one of our leadership development programs. So I started working with this one coach, and so I didn't know what coaching was. I had heard about it more from a almost like a disciplinary or punitive perspective, and I still hear that. So that's something that I know all of us as physician coaches are really trying to kind of break that stigma. I still hear that, oh, that person, they're not meeting expectations, they need a coach. And this was I hope I was meeting expectations at the time, but it was really more from the leadership development, personal growth, how to work with people in a different way. I think as physicians, we're not trained in that team environment. We're not necessarily trained how to work with a dyad partner or how to have people report to us. We're really trained to take care of the patient and use our clinical skills. And so some of those skills like delegation and having difficult conversations are just not, they're not natural to us. So I was offered a coach to help with some of those types of things, project planning, how to lead a team through a critical initiative, and so it highlighted for me how important coaching is, in addition to lots of other different coursework and other different leadership development programs that I was a part of. Coaching was it was like just somebody that was there just for me. So it was a great experience to be a part of.
Yeah, and it's so interesting to hear different backgrounds of individuals that come in and coaching is already a part of their culture in terms of if it's business. Like, of course, they had a coach, and so it's so normalized. And I think that question is like, do I actually need a coach, and what's this coaching all about? Is because for a lot of different institutions, it hasn't been normalized. And I've been delighted to see that within my own institution, it's extraordinarily normalized, and it's offered at every level in terms of definitely not just for remedial, but there are different courses that you can take in my institution about leading self, leading others, and it really helps you prep at each step. So I wanted to offer that as people open their mind, because if I had not had exposure to that in the medical setting, I would still be like, what is this coaching? And it took physician coaches like you for me to be like, what is coaching? And I'll share, I found it when I was at a state of profound burnout. And I know that's part of the story that I would love to hear from your perspective. And when people say, isn't a coach like a therapist? I'll say I had gone through so much therapy and I was still stuck. And so, and you can get therapy and coaching at the same time. And that coach helped me to take back ownership of my life. And so I'm just going to put out there, because I know some resistance is, well, aren't you just coaching people to stay in the system? I'm like, no, you're coaching people to do what's best in their best interest. So how does that relate to your own journey?
That's absolutely right. I have also been working with a therapist for the past probably 10 years. So it was again right around the time that I was going through my divorce, and they're complementary, they're different, and some people need both. Some people, a therapist is more appropriate, and maybe coaching later on down the line. It, they're definitely not mutually exclusive. We can do both at the same time. And I do get that a lot. Well, if I'm already working with a therapist, do I need a coach? And I think coaching really explores that mindset. And depending on the type of therapist that somebody works with, they might be more psychoanalytical or cognitive behavioral or dialectical behavioral. And so, but coaching is very much about focusing on the person and their own journey and their own healing and their own growth. I think therapy sometimes looks backwards a little bit more, and that's necessary in a lot of cases. It's been necessary in my case. But coaching is more forward focused and forward thinking and visionary. This is where I want to be in 6 months, 1 year, 3 years, 5 years, 10 years. This is the legacy I want to leave. This is the impact I want to make on the world around me. And how do I get there? And what might be some of the thoughts that are holding me back? What might be some of the barriers that I'm consciously or subconsciously putting in place? What might be expectations that society has of me that I either recognize or don't recognize? And how is that impacting my life? So all of those things are explored in coaching.
I think this is a great combined thought in terms of what we usually coach on is something that we've applied to our own life. And I know you coach on boundaries, self compassion, and really diving into your authenticity. Can you share what that looks like from your coaching perspective?
It's so interesting that I feel like when I'm coaching physicians, I coach physicians, nurse practitioners, and physician assistants primarily right now. It feels like the conversations that I have during coaching are spot on with something that I'm
Mhm.
either struggling with or wrestling with in my own life. And I don't know if that's just the universe trying to put in my lap these topics, but then I end up writing about them and writing. And I know you are such a prolific writer, and your message really resonates with me and with so many others. I end up writing about what is challenging for me, and it's helpful for me. It's therapeutic for me to work through some of those things. And so it's just so interesting that I think we maybe gravitate towards people that are wrestling with some of same things that we're wrestling with, because we've lived it and we are living it. And I think that's the great thing about coaching too, is that I'm certainly not here to say I have all the answers. I don't think any of us coaches that are in our space would say, yeah, we have all the answers. We're vulnerable too. We're human. We're wrestling with a lot of those same things. We've lived it, we've experienced it, and we've either maybe kind of come out the other side, or it's something we're still struggling with. And so how can we support each other? And I think that's a great thing about coaching is I'm not here to give the clients advice because I don't know their life. I'm not the expert in their life. I'm here to help them uncover what's best for them, what's authentic for them, and empower them. You use that word, and I love that word, that if I can empower somebody through coaching, then they're able to empower somebody else. And it just has such a ripple effect. So, but it is interesting that the conversations that come up when I'm coaching is like, oh, I'm struggling with that too. But then it's great because then I can take a deeper dive and I hear myself coaching somebody on it, and then I can coach myself through it. So it's fascinating and magical.
And it's a shared experience, I will admit. The people I thought would never want to come to me in the beginning were the people that had read my leaving surgery articles because I was very insecure and people will relate, had shame. Like even to put that article out there, I laugh. Why would a surgeon want to come to me? And that was the highest percentage of people that came to me right off the bat. I think because it's a safe space when they know that you understand and you're giving them that space to really truly explore from that deep level of your understanding. So the things that you write about, when people read it and they connect with it, like, she gets it. And I think that for coaching, always that one step in front, right, to help to understand but hold space. I think what you said is so great to open up that question of how does coaching differ from other helping services like mentorship, consulting, therapy.
Yeah. And I just had a conversation with about this morning with a prospective client, or a current client now, that like I said, I'm not there to give advice. And I think sometimes that's the expectation. Because if you think about a sports coach has knowledge about the sport or the game or the skill set that the player doesn't have. And so coaching a lot of times is viewed in that way, is that, well, I want the coach to tell me what to do. But coaching from our perspective is very much a peer to peer, and it's different from mentoring and advising and training and teaching them all up, which none of us, I wouldn't be here without any of that. But I tell my clinicians that I coach, I'm not here to give you advice because I'm not you. I don't live your experience. I don't live out your values. I don't I don't live in your world. And if I try to tell you, here's what I think you should do, or here's what I've done, then it's not authentic for them. And my role is as an expert in the process. They're the expert in their life. I'm the expert in the process. I can ask questions and reflect back to them, mirror back to them what I'm hearing, what I'm seeing, and utilize the coaching process to help uncover for them what's authentic and what's purposeful for them.
And I would love to give an example and be an example client. Not that you have to coach me, but I just really want to invite people to explore what coaching could look like in a topic that I know you coach on and that comes up all the time, is that people pleasing and challenges setting boundaries. So if I would come and a lot of my time management is off, I would appreciate you as a coach helping me guide to the core. And so we'll help them out by saying the core issue here is I'm a people pleaser, I'm having trouble saying no. And
Mhm.
how would a coach help navigate that person to set better boundaries?
Yeah. That's a great question. So the example that comes to mind is a lot of the coaching I do is we talk about work related challenges and non-work related challenges. So we do talk about family and personal life. So I was working with this one clinician who was about to go on vacation with her family, and it was kind of a family reunion style. There was an event they were going to, and she was traveling with her husband and her small children, and it was her husband's family, and she was telling me about this vacation. We were kind of chatting just really at the end of a conversation, and I could tell there was something just in the way she was talking to me because we were face to face via Zoom like this. And I picked up on some tension or just some discomfort in her. And I asked her, I said, "Hey, I'm sensing that there's something going on underneath what you're telling me. Uh, is there something that are you looking forward to the vacation, or is there something that you're nervous about?" And she said, "Yeah, I actually am really worried about having to please everybody around me, having to satisfy expectations of my family, because sometimes the things they want to do are not the things that I want to do." And I said, "Okay, well, let's explore that a little bit." what let's start with, what does it look like for you on vacation? What are the things that you want to accomplish on this vacation? Because it was a mix of tourist type destination and then also family reunion. I said, do you know what you want to accomplish? What's your goal of this trip? And she hadn't really thought about it. She just was like, I'm just going on this trip with my family. And she said, I'd really like to see this museum. I'd really like to go on this excursion. And then I'd like to rest too. I'd like to just enjoy time with my family. And so I said, okay, that's great. What do you think your family is expecting of you? Well, they're going to want to go here and here and here and here. And then there's tension with these two family members and they're going to argue. And I feel like I'm going to have to mediate. And so, okay, we talk about what might be those unspoken expectations. Is that true? I know that's a question that we ask ourselves in coaching a lot is it true? Is it absolutely true? The work of Byron Katie coming through. So she was talking about, well, they expect me to mediate. Okay, is that true? And so we kind of worked through that. And anyway, we the more we talked about it, the more she came to realize that, yeah, this is my trip too. I don't have to manage their feelings. I'm not in charge of their emotions. If they fight, that's not my problem. And we actually talked through some action planning. I said, you have little kids. That's a great excuse to get away. You use those children as an excuse to say, oh, so and so wants, we're going to go get ice cream because so and so's cranky. So we're going to get some space and go get some ice cream. We'll meet you guys later. And then when I talked to her after her trip, she was able to do that. She said, we used the ice cream a couple times when things were getting a little bit hairy. And she said it was really helpful just to kind of to pick up on when she was starting to get uncomfortable because family members were fighting with each other. So I thought that was just a great. It was great for me to see the shift in her, and I think that's what I love about coaching.
And what that story highlights is you really help that person see clarity on their end vision for themselves. It's, I think, from my own personal perspective, I have trouble setting boundaries if they have no vision of the perceived outcome that I desire. Therefore, it's harder to know the heck yeses, the heck nos, because I don't know end goal. So, really,
Right.
you walking with that individual and for them to stop and pause and to truly ask, what do I want? And then to measure their yeses and nos accordingly.
Yeah. It's so interesting how we have these thoughts about how do we define success or how do we define failure? How do we define a fun vacation? How will we look at the end of the vacation? What will we want to have accomplished and what we want to have got done? And I think we carry around a lot of these nebulous definitions and ideas in our mind, but until we clarify them, we're not gonna know whether we've achieved it or not. So
Mhm. This comes up a lot with the scarcity mindset, which I feel coaching helps with a lot, whether it's scarcity of money, time, anything.
mhm.
Yeah. And for burnout, I know that's becoming a trigger word because I think as we explore, as I was mentioning, it's, well, I don't want to coach myself so that I then fit into the mold of what they want for me. And it's like, okay, we got to
Right.
like wash that perception out. It's all about empowerment. So, from your journey, can you share how coaching helped you through burnout and help you to navigate? I know for me, burnout's been kind of a recurring theme in my life because I didn't put in place the changes in mindset. Can you share for you how coaching has been helpful?
Yeah. I as I think about my journey, I wouldn't say that I can look back and say, yes, here's a period of time I was burned out. However, there were so many challenges that I had personally, professionally. I mentioned my divorce and rebuilding the family structure that we have now, which is beautiful. And then also professional challenges that I've had where I've had setbacks, failures, that type of thing. And I think if I didn't have coaching at the time, if I didn't have somebody that was in my corner, then it could have easily spiraled into burnout and neglected. I could have neglected my physical, emotional health. And I think just having that kind of like a cheerleader, somebody to say, I'm here for you. I want what's best for you. And working with external coaches who didn't have my organization's best interests in mind. but knowing that as I align with what's true for me, that's gonna that's gonna be what's best for the organization too. And not, that's not everybody's case. That just was what was true for me at the time. Just helping me understand, okay, is it is it your job to make this person happy? Like I said, I coach on things that come up for me a lot, and that people pleasing has been a something that I still wrestle with,
Mhm.
because I feel like it's my job to manage other people's emotions, and if I say something that is going to upset somebody, then I'm the one who was wrong, and now I realize, okay, that's their trigger, that's their insecurity, those are their boundaries that have been crossed, and that's a reflection of them and not me. And so coaching has really helped me to navigate through some of those thoughts.
I think this is an important one to pause and repeat. Can you repeat the the overall concept that you just provided to the audience?
It is not my job to manage other people's emotions. If I say something that's triggering for another person, then that's a reflection of their boundaries. It's a reflection of their insecurities. It's a reflection of their priorities. It's a reflection of their triggers and whatever's going on for them. And it's not a reflection of me.
This is literally, I'm going to put this on repeat as a mantra because this is something I struggle with all of the time. And especially as you think you're getting progress, and then something where I turned down a task that was not my job, which is fine. I do things outside of my job all the time. We all do, right? And I just do not have the bandwidth. And it really wasn't, I already had identified kind of my outline goals, as you mentioned. It was not going to get me closer to them. It was just going to push me closer to my burnout and feeling of being devalued. There was a moment where I wanted to say yes just to say yes. And I was like, this is like internally a big heck no with profanity. Like, this is like a heck no. And I paused and I said, let me take a step back and think about it, because I needed that space to learn, how am I going to say no? Do I really need to say no? Is this an opportunity where I can say yes? It took me the rest of the day. I was spiraling with this indecision of, do I say yes or no? And where I think that was exhausting. So to your point is like, this person I could have identified from their perspective, they need this task done, it's their project, it's really important, there's another person assigned, they can do that task, but you take the ownership of, oh, I can help them get up to speed, and at what cost? Because yes, I mean, we're not going to say
Yes.
no all the time, but at what cost?
Right. Right. At what cost? That's such a good question. And you mentioned being exhausted just by the tension.
Mhm.
And that's another thing that's been really enlightening for me when working with my coaches, is just how the bodily sensations can, they're signals, right? Our emotions are signals, and we feel something in our body, we feel tension in our body, that's telling us something.
Mhm.
And so that's something that is, I'm getting a little bit better at, is listening to what's that tension in my chest, or what's that nausea type sensation telling me about what I, you know, I don't want to say should, I'm trying not to use that word, but what's the next right step, what's the next right action for me. And I think aligning with our values, or at least clarifying our values. I was actually doing this with a client yesterday. What are your core values? How do you identify what they are? And then how do you identify whether you're living in alignment with them? Because if we have a core value, say a family, but we're not spending time with our family, then that we're out of alignment with that value. And that's going to cause inner conflict and tension, and lead us to feel like something's not right. Just that restlessness that I know we've all felt.
Yeah, and since you brought up Byron and Katie, I was thinking, if people have no idea, because people pleasing can make us lost. Ask me how I know. Right? We get lost in trying to live out somebody else's life, and it's like, I don't even know what I want anymore. And Byron Katie, was her work was in Martha Beck's program, and I think Martha Beck's The Way of Integrity was such a great book to help people to gain insight. And they also have the body compass. Is, to your point,
Yes.
exactly what you're saying. I'm just putting a name to it. From what I've heard it as, is really exploring, what is my body telling me, and to trust your body, because what I've learned is you can outthink your body to be like, oh no, I think this is what it means. Like, no, 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 no.
Absolutely. And the body's going to win.
Mhm.
No matter what we do, the body is going to win. And it's not a battle, but the body is going to let us know when we are living out of alignment with our values in one way, shape, or form.
Yeah, and from a personal perspective, how many things that we can do maladaptive to disconnect from our body when it's sending the flares. I'm guilty of it, so this is not a judgment zone. But when it comes to like our relationships with anything, and I'll say my eating disorder was an addiction, right? So it's all in that same. How is that showing up for you? And no judgment, but what is that a sign? What's what can be modified in your life so that we're not grabbing these things that are really distracting ourselves from something that maybe we should lean into,
Hmm.
which brings me, of course, then that, we want to make sure people have the appropriate medical attention, but the extra support of someone, as you said, who's on your side and wants to see you win and is that really safe space. And as you help your clients to lean into who they are, how has that shown up in your life?
I feel just an additional need to practice what I preach
Hmm.
and to lean into what's best for me. I think coaching has definitely being a coach and then continuing to be coached has helped me to understand really what's my life's purpose, where am I going next, what's the next right step for me, but also being open to other possibilities. I was talking with my dear friend. We went to dinner the other night to celebrate one of her accomplishments, and I said 10 years ago, I never would have imagined that I am where I am now. Who knows where I'm going to be in 10 years from now? And so I think a lot of us, I know you've experienced this because we've talked about it, feel like we have this prescribed path for us.
Yep.
And that, again, that's another example of societal expectations and your mantra, permission to pivot. The world is full of endless possibilities. And so opening up to that and being curious and asking ourselves questions and using a lot of what Martha Beck talks about of making these 1 degree shifts and just feeling into what's right, I think is just it's beautiful. And when you're on that path and when you know you're on that path, it's unlike any experience I've had before. And then you're able to notice it more quickly and more often, or you're able to pick up on it more quickly when you're off track. And I think that's been helpful for me too, is when I get off track, when I get off kind of out of alignment with myself or lose connection with myself, I notice it much more quickly and then I have to course correct.
And how have the communities around you shifted as you've kind of leaned into who you are?
It's been really amazing to see. I think there's a little bit of that fear of, okay, if I go in this direction, are people going to think that's too woo woo? Or are people going to ask me, well, how can you be a doctor if you're not seeing patients? Isn't that what you're supposed to do? But I haven't seen that, and I think that's I'm very lucky because I know a lot of physicians struggle with that as they're are looking to see what's next for them. But my family, my friends have all been really supportive, and then just I mean, the ACE community, just so many amazing people that I've gotten to know and gotten to spend time with, and it's just it's wonderful, and I'm gonna start to cry.
Well, I'm gonna offer you something that may not help your tears, but I would just say like the energy of leaning in and being vulnerable, and then we connected. I felt like being vulnerable. It led me to people who created that safe space that had that true authenticity, and it was right to you, right? We immediately became friends, and I'm like, she'll love me. You're so considerate, so compassionate, so genuine. And that's what my heart was craving, especially after holding that mask for so long and feeling like people aren't going to accept me if they know who I really am, because we have that perfectionistic tendency and this vision of what we have to look like. And I would say just screwing it all has been the best thing I have ever done for myself and what I hope others can lean into as well. Because when we think about, to your point, of we can't control other people's feelings, when people are saying, wow, that's pretty woo. Well, I went through Martha Beck's program. She's grounded in science and she has a lot of creativity in the way that she works. And that creativity aspect has been so healing. So if people want to call me woo, I'm not offended. I'm like, that's what you probably need right now is a little bit more play. So
Right.
you're welcome to join me when you have accepted that it may be what you need or not. And because if they're going to place judgment, that's not the energy we want here. We have the positive vibes, dance, and compassion, and get out of their negative energy dance just for those people. But also that question of identity when it comes to being a physician or anything that we hold on to, it definitely comes up a lot. So I think when you ground yourself through coaching or through whatever it is, shamanic healing or just sitting with yourself, meditating, a lot of people have different modalities that allow them to connect with themselves. I feel the more grounded we are internally, the less that noise matters. Like, yes, people say things to me all the time and it does hurt, but I sit with it of what's true, what's not. And as we know from conversations about bullying, and even what we just mentioned, it's always a reflection of that other person's biases if they project on you.
Absolutely. And it's like you said, it doesn't mean that those comments don't sting, because they do, because we're human, and that's what happens. We want to be accepted by the tribe, but then we can notice it and say, okay, yeah, that if somebody calls me woo woo, that's fine. Yeah, I am kind of woo woo and I love it. And
Yeah,
it makes me a better person, makes me a
exactly.
better wife, it makes me a better mother, makes me a better friend, a better daughter, makes me a better physician. All those things, and I wouldn't trade it for anything.
Yeah, I really highlight that too because I hear, especially in physician groups or someone that knows my background, they always, I'm sorry, this is a little woo. I'm like, bring it on. But it's always an apology before they bring it in. I'm like, you can't out woo what I'm craving in my life right now. But it's that insecurity in what we offer. And it came up for me as a coach too, when I was saying I had insecurities about surgeons. And I think the universe provided me surgeons that also needed to provide me that opportunity to see them as humans. And we related, so many of us are very much the same, especially female surgeons that are just craving the ability to embrace who we truly want to be. And also then not, we have biases that we are trying to defend, say, like, I don't want to be seen that way. So I think sometimes we really try to hold up our persona to fight stigma and then get lost in that like kind of armor. And men and women surgeons that are trying to just be more human and put their values, you were mentioning about spending time with family, and sometimes people that have jobs that are known to be long hours have come and they're embarrassed to admit that they want to spend more time with family. And I'm like, that embarrassment is a reflection of what society and what the culture has put onto you. Like, I'm championing that because if people know, for me, it was when I lost my ex-boyfriend, I was like, yeah, none of that matters. Like, you prioritize what you really value right now because we just never know.
Yeah, that's absolutely true. That's absolutely true.
So thank you so much for being here and sharing your story. And before we share with everyone where they can find you, I of course noticed your very fashionable scrubs, so we want to give a shout out. Can you tell us
Yes.
about the scrubs that you're wearing?
Yes, so I bought this at the ACE conference that you mentioned, where we got to meet in person. So these are Green Cloud scrubs by our amazing physician colleague, Dr. Lori Boge. And she created these to help us to feel confident and beautiful and all the amazing things in our scrubs, so that we're not stuck in these shapeless and scratchy scrubs. And I actually wear this more as a nice top to go out and have brunch or out shopping, and it's so comfortable. I washed it 3 days ago, put it in the dryer immediately after washing, and then just took it out of the dryer about an hour ago and put it on, and it is wrinkle free and so comfortable and so soft. And so Green Cloud scrubs, I'm not going to buy any other scrubs ever again.
And
They're
of course,
amazing.
we're not affiliated, so we want to throw that out.
No.
I always say to people, we were just making a joke that in order to be on the channel, you'll notice people wear green collar scrubs because when we love Dr. Lori Bosch and her mission, but the scrubs are truly phenomenal.
Yes, yes, yeah. They're beautiful and amazing.
Yeah, and I'll make sure to put that link in the comment. And along with that link, where can people find you?
So I am at www.thepurposefulmd.com is my website, and there's a how to work with me page there, and a little bit more about me and my philosophy. And I'm also on Facebook as Purposeful MD. And then I also am on LinkedIn as Laura Sutton MD as myself. So
Awesome. Well, thank you, Dr. Sutton, for joining me today. And thank you to our audience for being here. Make sure to drop your comments below and connect to Dr. Sutton for any coaching queries and see if you're a good fit to coach together.
great. Thank you so much.
Yes. Till next time.